And of course, now next we will be speaking to the governor of Kitui, that is Charity Ngilu. She'll be joining us to speak about the preparedness of the county in as far as matters preparation to combat the virus is concerned. As soon as we have her, we'll be talking about that. But first, let's begin with what the Cabinet Secretary, that is Mutahi Kagwe, said towards the end of last week, in as far as that now you will need a mask as you go to public places. Of course, this has caused a stir across the country, people talking about it and wondering where to get that mask because as of now, it appears to be a bit expensive. Let's just listen to Mutahi Kagwe on that.
If you are getting into a matatu, you are advised to wear a mask. If you are going to ride a tuk-tuk, you are advised to wear a mask. Beginning today, we have begun local production of the face masks.
But we are not saying that people should be sitting around waiting, for masks to come to them. Wananchis now have been given freedom, to make them. And we have said these things should be made as cheaply as possible.
All right, that is the Cabinet Secretary of Health, Mutahi Kagwe. Now I want us to speak to a former Cabinet Secretary, a former Minister for Health in the Kibaki region, that is Charity Ngilu, who is currently the Governor of Kitui County. Good morning, Governor, and how are you doing?
We are doing very well in Kitui. Like all other government officers, we have slowed down. We have released a lot of our people to go home.
Right.
But we have kept some people who are working at Kitui County Textile Center because that is where we are producing masks. We have been producing administration uniforms, but we shelved that so that we can make masks fast.
Okay, and Governor, of course, we're waking up to a week where we've been advised by the Ministry of Health that we need to have our own masks. Maybe you can tell us a little bit about what the Kikotech, that is the Kitui County Textile Company or Textile Center, is doing in as far as preparing this. And would you tell us about the raw materials you're using and probably the price that you should be getting them at?
We have retained them in the place of work, because there are about 350 of them at the moment. We have split them in shifts just to make sure that they are keeping the distance from each other. We have also ensured that they are sleeping in the same place. They are not getting out of the place to be in contact with anybody. And therefore, we are now able to produce without difficulties. And of course, because they are producing too many of them, not too many of them, I wish we could produce much more than this. We have hit a mark of 20,000 per day. And I think we are going to go up 30,000 per day because this is something which is new to us. We were not making this before. And therefore, we do believe that we will be able to make more masks for Kenyans. We are using non-woven material, which is what has been recommended and actually certified by Kenya Bureau of Standards, and we have got a certificate for that. And therefore, we are very happy to be able to produce these masks.
And of course, it's such a milestone for Kitui and obviously the country. But I'm just concerned with the masks that you're producing. You're saying that you might be hitting 30,000 masks every day. What is the distribution channel like? Are they for the Kitui people or are they for the country? And so far, have you been able to sell them out?
We are checking, yes. We are checking first and foremost because obviously there are some very, very needy areas than others. We want to make sure that at least the hospitals have, hospital health workers have masks. I have also, contracted some local women outside their shop, and I've showed some of them what they need to do They are not the high quality that Kikotech is producing, but they are able to produce some semblance of masks, and we help them to sanitize them.
Right.
Yes.
Okay, Governor. Now let's focus on your county, because understandably we had from the Council of Governors sometimes last week, and they were saying that out of the 47 counties, there are 22 counties that have no single ICU bed, and there are also 22 counties that have no single ventilator. And your county, that is Kitui, was one of those that are listed not to have any ICU facility or not to have any ventilator. I mean, how does this settle with you? And would you say that as a county you're prepared to deal with any eventuality should there be an upsurge of numbers of people that have contracted the coronavirus disease?
Sam, what we have been able to do here is to have one hospital, Kauwi Hospital, level 4 hospital. That's the one we isolated and we set aside to say, this is where we are bringing anybody who presents with such symptoms. We therefore have put people there, and as you are aware, Kitui is one of them that even had a case of a patient who actually tested positive. And the cook of that patient has also tested positive. So whenever we get cases like this, and we have gotten very many, we take them there, we bring them to Nairobi, they get tested. If they are found to be positive, then they stay in Nairobi. If they are not positive, they come back, and we are putting them in our ambulances. Yes, we do not have ventilators, we do not have ICU facilities, but simply because we were doing that. We were doing that already.
Right.
Yes.
Governor, that you should say that when they test positive in Nairobi, they stay in Nairobi. I'm looking at the capacity of Mbagathi Infectious Diseases Center, Isolation and Treatment Center, that has a bed capacity of 120. The Kenyatta National Hospital has a bed capacity of 20. So 20 plus 120, that's 140 in public hospitals in Nairobi. If the numbers go beyond that, because already we have 126 positive cases, of course, some have died, some have recovered. If the numbers get beyond that and have to be distributed back to their home counties, what do you think you will have to do for Kitui residents?
I think what we have got to do very quickly right now is to get these ICU beds and ventilators procured and brought to our counties. We cannot continue to talk. We know where we need to buy them from. I noticed a 4,000 hospital was put up in London within 9 days. We need to distribute our forces. Maybe we can come to our aid and they put up these places, hospitals. Let the beds come from where they need to come from. Let the ventilators come from where they need to come from. The personal protective equipment, gears, are not enough. The health workers will not touch anybody if they are not properly protected. We have all of them. They come, they see a person. They cannot touch a person who presents with such symptoms if they do not have the protective gear. They will not touch. Yes.
And of course, understandably so, because they have to protect their lives as well. But Governor, you said that you're going to have ICU beds and obviously maybe ventilators should that need a rise. But do you know the cost of an ICU bed that now you need to go and procure? And how is that process? Because it's too late in the day to prepare for how to handle such cases.
You see, we must be allowed to have them procured even by the national government, because right here we cannot procure in the same usual way. We go out for quotation, or we go out for procurement processes. Because if you do so, then you waste time. And in this county, we have already lost one very important person. Our Captain Kimuyu Kibati died also saving people. We only buried him on Saturday. It feels sad that we are putting our workers on the line while they are saving people.
And condolences for that, Governor. But still on the question of the ICU beds, do you know the cost? And if yes, then what happens? Because already you have a budget for this year. What will you do to move certain money to financing that?
I do not have the right price right now.
Mm-hmm.
But I have been given to understand that ICU beds will cost as much as even 30,000 shillings each.
Sorry, what did you say, Governor?
25 to 35,000 shillings. I am not sure about that figure.
Oh, okay. I heard you say 25,000. I'm wondering whether it's 25,000 or million.
A million.
Okay. All right. So, Governor, now moving forward, what assurance...
A bed, I don't know what it entails, but
okay.
I don't see how a bed costs $1 million shillings. I don't know.
Okay, but how would you rate the collaboration with the national government in boosting capacity for the counties? What are the gaps that you see, and what do you think should be the quick intervention? Because as we were told by the minister, is that the numbers are just about to grow exponentially. Let
me just say here, we are slow in decision making. We are slow in decision making.
Mm-hmm.
Once we sit, once we agree on what needs to be done, it has got to be done immediately. Education is being done very well. Creating awareness is being done very well. Washing hands, keeping distance, and telling people to stay away and all this, and the quarantining people is very good.
Okay.
We are slow in acting. Like we have talked about ICU, having ICU in every county.
Mm-hmm.
We know what needs to be done. Surely. We know what needs to be done. We have got rooms. I've already set aside the rooms where we should have ICU. We have prepared the room. It has got power in it. We need to look at health workers.
Mm-hmm.
Where are the doctors? How many can we have in account? Can we have the equipment? Even simple things like thermoscanner. You know,
mm-hmm.
thermoscanners?
Right.
They are not available.
Mm.
And the no-nurse will now touch the normal scanning equipment for checking your temperature.
But Governor, whose challenge is that? Because if you don't have the thermal scanners, I'm imagining these are tools that are very important for public health. Is it the responsibility of the national government or your government as the governor of Kitui?
You know, our budgets are also a bit stretched
mm-hmm.
right now. And in the past, we have never had something like this, that we needed thermal scanners.
Okay.
You know, we were always using this local normal, thermal, what are they called?
Thermometers.
Thermometers.
Yes.
Now, if we were using this normal thermometer,
mm-hmm.
and nobody cared about thermal scanners, but now we realize we have bought thermal scanners ourselves. However, right now, you know, everything has skyrocketed.
Mm-hmm.
Instead of getting a thermal scanner for the usual 5,000 shillings,
mm-hmm.
they all have gone to 30,000.
Mm-hmm.
A thermal scanner, I mean. But now we have 300 health facilities.
Right.
Can I afford at least even, 300 of them, 500 of them? No, I can't.
Mm.
Especially not now when, remember, we are in the final quarter of the budget.
So, Governor, is it possible for the Council of Governors to come together and probably do a joint procurement of those essential commodities, for instance, the thermal scanners that you're talking about? What's stopping you from doing that?
Let me tell you, we are still restricted by procurement processes and procedures and the Public Finance Management Act and the laws.
Mm-hmm.
They have not been saying you can get them when you can. And then we can all agree, if we can even be given a window
mm-hmm.
that you can buy at least, but let it be controlled. we also are restricted, quite honestly. We are restricted.
Okay. All right. Thank you so much, Governor Charity Ngilu of Kitui, for sharing your insights with us this morning. And we wish you well, even as you raise the response back in Kitui County.
I want to say one more thing to Kenyans.
Okay.
I want to say to Kenyans that there is hope. There is hope. And I want to say that let people keep these basic rules. Keep away from each other. Make sure that you can report any case that looks like as a symptoms. Wash your hands. Don't touch your face. Stay away from each other for the time being. This thing is going to pass.
Okay.
It has not hit Kenya and hit even this county too hard. I'm sure we'll get over this thing.
All right. Thank you so much, Governor.
Yeah.
And I'm sure there will be... Yes.
Thank you so much indeed.
All right, and I'm sure they'll be looking up to you for services and to improve the capacity back in Kitui and, of course, at different parts of the country. Thank you. That's Governor Charity Ngilu from Kitui County. And now I want us to speak to the Governor of Isiolo County, that is Mohammed Kuti, who is also the chairperson of the Council of Governors Committee on Health. Good morning, Governor, and I don't know, how are you doing?
Good morning.
Great, and we thank you for joining us this morning. And it's just from a conversation with the Governor of Kitui County, Charity Ngilu, and some of the issues that she raises in as far as the county preparedness specific to her county is that there are challenges in procuring very essential commodities. For instance, talking about thermal scanners that they may need at that county. I don't know what solutions you have been pursuing at the Council of Governors and also sitting at the National Emergency Response Committee on Coronavirus.
Well, I would like to say that first, we have very good linkages with the national government, and the procurement is mainly done at FEMSA for the counties. And I mean, I can't say that it is fully adequate, but there are commodities that keep coming.
Right.
I think like yesterday we received face masks, quite a large number. We received personal protection equipment for the medical staff.
Right.
So I think they keep coming. You know, this is a new disease, and most of these are not stocked as regular commodities. So I think procurement is still ongoing.
Okay.
And they initially are coming in trickles, but it still keeps they continue increasing, and therefore I think we may not have adequate, but we are getting. I think that's what I can say.
Okay, you say we don't have adequate, but we're getting there. But I'm just wondering, of course, the procurement laws are there to be followed, but in times of emergencies, are there any adjustments that have been made so that you can assist several of these counties that even the Council of Governors last week told us that there is a wide level of unpreparedness?
It's important that we lax the stringent procurement procedures. We had a meeting in Nairobi between the Council of Governors and the Cabinet Secretaries, and even the Cabinet Secretary for Finance, Mr. Okuri Atani, was there. And I think a request was made that these procurement procedures be laxed a bit while still keeping the key steps. And I think that is being looked into. We have not gotten a feedback yet. It's supposed to involve the controller of budget, it's supposed to involve the Auditor General, it's supposed to involve the procurement authority, and even National Treasury.
Right.
And I think that discussion is ongoing, and maybe hopefully very soon we'll be able to get some feedback on that. Also we can call the assembly for special sittings if need arises.
Right.
So I think I cannot say there is so much barrier, because there are also within the procurement laws provisions for emergencies.
Okay, and Governor, I want briefly to speak about your county, because I'm looking at Isiolo County. I know you have an isolation ward, but then again, when I look at the statistics that were released by the Council of Governors that you also sit in, they are saying that Isiolo has no ICU facilities, has no ventilator, and luckily you have not received any case that would be coming from Isiolo County. But should that arise, I mean, how have you prepared yourself to deal with such eventualities, especially if the cases are to proceed to become severe or critical?
Yeah, it's true. We do not have ICU. We have an isolation ward that we want to upgrade eventually and put in ICU facility. We have already procured, I think, 6 units of ventilators from MEDS, the Mission for Essential Drug Supplies. And they had only those numbers, so we were lucky, and we had already booked, and we are preparing for the payment so that we could have ventilators and we could have ICU facility at Isiolo.
And so at the moment, I don't know what's the capacity at the isolation ward, and have you admitted anybody there, even if it's for observation?
Yeah, we have 20 beds at the level 4 referral facility. We also have about 10 at the sub-counties and also smaller numbers at the health centers, at various health centers in Ngilu, in Suricho, in Modogash, those areas which are far-flung. But the main one is the level 4 Isiolo referral facility, which has 20 beds so far, with even possibility for expansion, because, you know, we have removed Kenya Medical Training College students and converted the KMTC college into our isolation facility.
Right.
We also have quarantine facilities that we have prepared, and we have set aside 20 secondary schools, and especially those with boarding facilities, so that should there be spillovers or should there be need for quarantine, we are able to quarantine them in those schools.
Okay, and you speak about the quarantine facilities. Of course, the Cabinet Secretary, Mutahi Kagwe, announced that we should at least have a capacity of 1,000, depending on the population of every county. Specifically, how are you going to handle this? Because you've had complaints from different quarantine centers, some of them in Nairobi, where those that are being held, they have been complaining that they're having to share services, to share facilities. How do you change that when it comes to the secondary schools that you're talking of, the boarding schools, where we know that even these ablution facilities are not as many as the number of students?
Well, I have to admit that, you know, this quarantine facility, the best would be if Kenyans, you know, will have observed the self-quarantine diligently. Then the best would have been people should have self-quarantined themselves. But now that is not possible because of you know, the discipline issues involved, it's better to you know, put people in these quarantine facilities, even though they are not very adequate or they are not up to standard.
Right.
But I think it's better because the alternative to that is to release the disease into the community. That's right. I think it's kind of like a sacrifice people have to, you know, bear, and in order to, because this is a fast spreading disease, and therefore, unless we separate those who are suspected from the rest of the community, then we're just going to have an explosion.
Right. And Governor, like I said earlier on, you sit at the National Emergency Response Committee on Coronavirus, and we've been hearing of pronouncements coming from the chairperson of that committee, including what we have from the Director General, the Acting Director General, that the numbers could rise up to 5,000 by mid of this month, and by the end of this month, there might be a 10,000. From your analysis and looking at the trend so far, do you think we'll hit that number based on the measures that we are taking as a country?
Well, I must congratulate the National Emergency Response Committee headed by Minister Kagwe. I think we very early in this disease, before even we were hit, and I would like to really praise the effort by His Excellency the President to form this committee and drive the awareness campaign very early. And I think this has really taken effect among our people. But I think still the issue of social distancing is an issue in the markets. It is still an issue in crowded, lower income, high density populations. So there's still a threat there. So definitely numbers could rise, because right now we are not having the disease coming from outside Kenya. Now it is within the country. There's now a transmission from Kenyans to Kenyans. So this is a threat. It is good that the measures of reducing the number of people in matatus and even for the borders to carry only one person. But I think there's one area and which we still are worried about is the movement between counties. Right. Because we still have people from Nairobi coming to the rural areas. The worry more is now that it's April and it's Easter. There is the trend of Kenyans moving to the rural homes, and I think this is where I would actually like to use this forum to urge Kenyans not to travel to the rural folks, because this disease affects and those who go to critical levels, and the deaths are more as the years go above 55, 60 there and above. Okay. So our rural folks are at major threat should we transport these diseases to them in the rural area. The other thing is that still there are a lot of passenger buses traveling. For example, Isiolo, we get a lot of people coming from Nairobi, a lot of people coming from Marsabit, Moyale, and we even fear maybe some of them are across the border from Ethiopia. So I think the movement within counties, because we now have counties which are positive, and we also have counties which up to now have not gotten a single case. Okay. It will be good if we very quickly find a way of confining those that are positive within those counties and protecting the counties that have not had positive yet by seriously considering movements between counties.
Governor, I hear you loud and clear, but I'm just wondering because, of course, there has been that complaint that people are still moving in and out of, especially Nairobi. There was the concern that this is Easter, and of course, this coming weekend is the Easter weekend. What would you propose? Because I hear you saying that there should be a mechanism of barring people from movement. What exactly is that you're talking about?
Well, at this time, I'm just giving advisory. And I think this discussion, I'm sure, is being considered, but all I'm saying at this particular time, it's, this disease is about individual restraint. Okay. I mean, we're telling people to wash hands. That's personal, individual level. We're telling people to keep distance between one another. This is individual effort. And in the same vein, we should actually not travel, to the rural areas in Nairobi. We should stay in Nairobi.
Okay.
And, minimize movement, because most counties that have succeeded to keep their curve flat is mainly from avoiding movements, and the more, or rather the less the movement, the better chance of flattening the curve.
Okay, all right. Thank you so much, Governor. Excuse me, Mohammed Kitui, who is the governor of Isiolo County. At the same time, he sits at the National Emergency Response Committee on Coronavirus. Thank you so much for your time, and wish you well as you continue with your contribution at NERC, and at the same time as you chair the Committee of Health at the Council of Governors. We know